of America, in the 21st century, being pregnant and giving birth should not carry such great risk.
Vice President Kamala Harris calling on lawmakers to pass the Buildback Better Act, which includes billions to improve maternal health in America. Thank you so much for staying with us. I'm Vanessa Freeman.
And I'm Tamsa Vidal. Well, we are talking about some $3 billion money to be used not just for maternal and perinatal health, but for initiatives to study and to improve a badly broken system. Most recent stats from the CDC date back to 2018. That year, 658 women died while pregnant. It breaks down to more than 17 deaths per 100,000 live births.
Separately, African American women are much more likely to fall victim at more than 37 per 1,000 births. Joining us right now to weigh in is Jaye Wilson of the advocacy group Melinated Moms. Jaye, thank you so much for being with us.
Thank you so much for having me.
Yes, I'm sure. Yeah, of course, this moment I'm sure was notable for you, a notable moment, having worked with New Jersey First Lady Tammy Murphy and her efforts for equitable maternal health, and this being really the first time the White House has marked a maternal health day of action. In your opinion, why is this push by the White House so important?
It's incredibly important because it brings visibility to a space where our community feels that we've never been seen in. Right. So when it comes to all of the deaths and the near misses, a lot of Black women and women of other ethnicities, they often share their stories of how they knew something was wrong or they felt there was something else that they needed help with. And when they went to their medical professionals, their complaints fell on deaf ears. So for the White House to bring this to a call to action for the entire country, it's major. So they're seeing the significance of having a space to give a huge voice to the needs of moms and women.
Well, the numbers really are staggering. What sort of programs do you foresee the money from the Build Back Better Act being used for in all this?
Yeah, so I see a lot of infrastructure being able to be built around family needs. We saw that how the pandemic also impacted the way a lot of people were able to take care of their families, right? So not being able to work or having to change a lot of the dynamics of how you worked, it impacted families. So with this Build Back Better Act, they're able to create new revisions for childcare. They're also able to create better opportunities for moms postpartum to actually heal from the time that they have delivered, to be with their child, to bond, also to make sure that they're looking at any indicators that they may have had a complication postpartum, right? So a lot of women on average are going back to work 2 weeks after giving birth, which is putting them at a higher risk of having more complications or morbidities. So with this Build Back Better Act, or funding rather, a lot of moms and families are able to rest easier, that they're not going to have to rush back into that.
This is really universal for all moms. And when we look at the numbers here, Jaye, New Jersey, number 4 for maternal death rates in the country. Why do you believe this disparity exists? And as we sit here now in December, retrospectively looking back for the entire year, have you seen any improvements? What are the numbers so far right now?
Yeah, so New Jersey is, unfortunately, we're in the bottom 5. However, I'm very glad to say that we've been very instrumental in working with the current governor, Governor Murphy, and the First Lady on the Nurture New Jersey Act, or initiative, rather, to improve what the birthing statistics look like for the state of New Jersey. I'm also a member of the MCQC, which is Maternal Care Quality Collaborative, which does work to look at what these quality initiatives are in our state and how to hold spaces accountable, including the hospitals, the medical providers, all of the systems that our families are enacting in, right? So knowing that New Jersey recognizes where we are, but we're not going to take that lying down. We're doing the work statistically on paper, but also in real time. And we're also bringing our families to the table so that they see the changes happening with the state.
I have to ask, how powerful is it to have this message coming from Vice President Kamala Harris?
It's incredibly powerful. It helps us, again, to be seen. Like at the very beginning of her opening address, she talked about systemic inequities. And a lot of people don't realize how many of these things exist when it comes to childbirth, especially for women of color. we never get to see ourselves in any spaces that are positive. So for her to be a woman of color, be a woman in such a powerful position, and then also bring visibility to something that is taking us away from this world is incredibly powerful. I'm very honored to see that she's really paying attention, and she's also bringing this to the forefront of all of America.
Yeah, and we know when it comes to women's health issues, this type of advocacy really never ends. So Jaye Wilson of Melinated Moms, we thank you for all the work you're doing and for being with us today.
I appreciate it. Have a great day.